The standard of testing on guinea pigs now appears to have altered its course of operation. Doctors have shifted their operating methods to a much less brutal method via testing their theories on robots. The day is not far away when we actually deal with robots in our daily lives. Here's something you simply cannot miss out on in this video. Watch till the end to find out how doctors are using robots to perform surgeries. The iRobot situation doesn't appear to be too far from the present day. With that being said, ask yourself, isn't it fascinating in the history of medical procedures to have a robot help train the doctors with clinical surgeries? Hey there, welcome back to the channel. With yet another exciting video, we've come to shower you with a brand new dimension of knowledge on robotics and the field of technology. In today's video, we'll be talking about the usefulness of robots in the upcoming years while doctors perform surgeries. So hit the like button and subscribe to the channel. And turn the bell icon on so that you never miss out on any such new content. The area of robot technology has evolved a long way. The things we could never imagine are now easily possible, from robot taxis to robot traffic cops. Robotics is evolving and upgrading itself with great speed. Apart from being useful in household chores, robots are impeccable with their knowledge and excellent in critical things. The best part about robots, they're not humans. Therefore, if they know something, they will never fail in it. That is where the importance of robots kick in, especially for the cause of saving lives. It's true that one will be confused when asked to imagine getting handled by a robot doctor for surgery. Don't worry, a robot will not directly operate on you, but will definitely be present to help the heading doctor. In the medical field, robots are revolutionizing surgery, expediting supply delivery and cleaning, and freeing up doctors to spend more time connecting with and caring for patients. For the creation of medical robots, Intel offers a varied array of technology, including surgical assistants, modular and autonomous mobile robots. Towards developing an efficient performance, it is imperative for the doctors to test and try out their techniques on living beings other than a dummy toy. However, the situation is not the same in the case of human beings. In circumstances of emergency, the human in distress will never remain calm. During that time, operating or even providing the minimum care, always an experienced doctor is preferred. But a newbie will not be able to provide care amidst the distraction of pain and distress. Simply put, doctors are not trained to handle practical situations. They are trained to operate on dummies. And in order to increase their level of expertise in such cases, doctors need to upskill themselves by way of experience, and that would take a lot of years. Is it worth it? At least for doctors, are having studied hard for years, qualifying for the examinations, they are doctors, but just a resident. They again have to undergo a residentship for a few more years to finally be able to operate wholly. That's a long time. This time, for the ease of the doctor, technology has stepped up to provide the optimum help to doctors by way of practical experience when operating on a humanoid robot. Let's take an example of a dentist. Dentists are trained to operate inside the mouth region. However, there are a lot more issues rather than just operating. Firstly, the mouth opening is comparatively small to be fit for the entire procedure. Secondly, teeth issues cause a high quantum of distress to the patient. Regardless of whether the patient is an adult or a child, it's impossible to be still while the doctor operates. In this situation, a doctor trained on dummy dolls will not effectively cry out the procedure because he, again, is a human being and is not used to such loudness. To make doctors accustomed to the environment, robots are developed in Japan. These robots are programmed to create distress in critical situations to help doctors to get accustomed to medical emergencies. Yusuke Ishii, TMSUK Engineering Division Director, said, "The medical workers really need to experience medical emergencies. It is important that they experience a situation where something goes wrong, and that's what it can simulate." It is difficult to get experience in pediatric dentistry because there are no opportunities to practice. In addition, there's the risk that children will move wildly because with children, when their medical condition worsens suddenly, it's hard for them to express that situation. The robot was developed by Showa University Dental Hospital's Department of Orthodontics, in collaboration with the Japanese robotic startup TMSUK, Practical Robotic Solutions. The company has rolled out a robot that might seem weird at first glance, but is highly effective in the medical field. The horrifying lifelike robot child who cries, vomits, and thrashes around is being used by trainee dentists to help prepare them for an unruly young patient. The company named her Pediaroid, a pediatric patient-type robot that can realistically simulate the jittery movements of a child who is not interested in getting medical care during an emergency situation. Handling a young kid during procedures is the toughest thing for doctors to do. If they miss that out, it might turn out to be a nightmare, which you don't want to simulate. Pediaroid is a robot representation of a child who is reluctant to receive treatment when struck with a sudden change in medical condition. Let's roll over to examine the functions of this humanoid. There are 6 classifications made to the body on the basis of movement: mouth and speech, body, eyes, face or head, chest, and arms. Let's talk about the mouth and speech part. The robot can depict and replicate a variety of emotions. For example, it can greet and give emotional expressions such as it can cry, express pain, and start screaming. It can open and close its mouth, sneeze, cough, and also vomit. That's amazing, isn't it? The program has given further details emphasizing on the tongue movements such as backward, forward, left, and right. When it comes to the body, the robot can move both its arms and legs, whirling and flapping them. It can enact convulsions such as tonic spasms and clonic spasms and can also act exhausted. This way, the doctors have to exert more pressure in pinning down the rampant limbs and perform therapeutic training closer to practice. For its facial expression, the skin of the robot can change color. It can cause pallor and even flush looking at you. The reluctance in obtaining treatment is emphasized by programming various reluctant head movements, up, down, left, and right. The developers have put extra effort into pulling up a realistic eye. The eye of this robot can close and open, along with which it can move its pupil to depict mydriasis, constriction, and counter-reflex. Well, robots can breathe, but while performing surgeries, it is important for them to replicate a human-like heartbeat. In response to the breathing system inside the robot, it can depict an up and down movement and breathing sounds like wheezing. To emphasize the monitoring part, the robot is programmed to produce labored breathing, even to take into CPR and auscultating heart sounds. In order to make practice more realistic, the robot's arms are developed in such a way that the doctors can sense the pulses and measure blood pressure and blood oxygen saturation. Doctors can also conduct CRT, which is the capillary refill test, and can even collect blood by administering injections from the back of the hand. Pediaroid is the 3rd generation creation. Previously, experts have created 2 other models. This newest version comes with a separate tablet, allowing the instructor to control the type of disease, along with a panel to control bodily functions, such as sneezing, coughing, and throwing up. Users can also send signals to air cylinders in the robot's joints to cause movement across its entire body, including the mouth and tongue. The vice director of Showa University Dental Hospital, Kotaro Maki, said, "Medical skill and ability are first built upon failure. One's skills only improve once they have failed once. Therefore, we figured that a robot is the only way that would allow students to learn from their failures without inconveniencing patients. To date, the patent of this robot is pending. Only after its approval will we be able to get a complete picture of its production." The robot is quite fascinating when you think about the future prospect of it in the field of medicine. What is your opinion on this applicability in the medical world? Do you think it's practical? Comment down your views, hit the like and subscribe buttons, and also turn on the notification bell to never miss any new videos.